Why you must always throw the frisbee more than 50 yards away from you. If you are used to throwing a ball or throwing a frisbee, always throw it at about 50 yards away from you. Why? This will be the topic of this video. This is video 3 in a 6-video series that discusses common conditions that cause limping in dogs. And in this video, as I said earlier, we are going to discuss anterior cruciate ligament tear. What has a frisbee got to do with anterior cruciate ligament tear? And what is an anterior cruciate ligament tear? Anterior cruciate ligament tear is a traumatic injury to the stapler joint that leads to a complete or partial tear of the anterior cruciate ligament. How does this happen? Let's find out from now until the end of this video. So just keep watching. First of all, let's look at the structure of the stapler joint. Alright, this is a very excellent image of the stapler joint. You have the femur, the distal part of the femur. You have the upper portion of the tibia. And then you have the collateral ligaments. Lateral collateral ligament. And the medial collateral ligament. These ligaments prevent hip injuries that might destroy the structure, might destroy the joint. Injuries coming from the left or right of the hip joint. Then you have anterior cruciate ligament, which is this ligament here, and the caudal cruciate ligament. The anterior cruciate ligament originates from the distal floor of the femur and attaches to the cranial portion of the tibia, right there. The posterior part of the cruciate ligament originates from the cranial loop of the femur and attaches to the distal floor of the tibia, right? So they look like a cross, one running like that and the one running that. But they stabilize the stapler joint and prevent injuries that might come from the front or back and destroy the stapler joint. Or they stabilize the stapler joint. The cruciate ligaments and the lateral, medial and collateral ligaments, and the left collateral and the lateral collateral ligament. You have a meniscus here, lateral one, the medial one, right? They cushion the femur and the tibia. Right? That's the basic structure of the stapler joint. You have the patella tendon here and the trochlear groove where the patella tendon glides along to stabilize make the movement of the knee pretty easy. This is the fibula here. But that basically is the structure of the knee joint, with the most important ligament being the anterior cruciate ligament. This is the one that is torn most of the time. You are going to learn why the anterior cruciate ligament is the most prone to injuries. Right? You've got other ligaments like that one, like the collateral ligaments. You have the posterior ligament there, and those are not prone to most of the injuries, because most of the injuries occur when the knee is being flexed and there's too much tension on the anterior cruciate ligament. We shall look at that as we go along. The stapler joint is comprised of the lower end of the femur bone and the upper end of the tibia. On the front head of the joint is the patella bone, and on the rear head there are two vertebral bones which are part of the medial and lateral head of the gastrocnemius muscle. These bones assist with the smooth movement of the tendons over the stylo joint. The stylo joint is stabilized by lateral and medial collateral ligaments which prevent abduction or overextension of the stylo joint, and adduction, which is the overextension of the medial overextension of the stylo joint. Or rather, these two ligaments, they stop any injuries that could be coming from the lateral side or medial side of the stylo joint. The anterior and posterior cruciate ligaments restrict forward and backward movements of the femur and tibia. The anterior cruciate ligament also resists overflexion and inward rotation of the stylo joint. The posterior cruciate ligament originates at the cranial head, at the roof of the femur, and attaches to the caudal floor of the tibia. The anterior cruciate ligament originates at the caudal head of the roof of the femur and attaches to the cranial floor of the tibia. Right? We'll go that one here again. The anterior cruciate from the distal roof of the femur, the cranial floor of the tibia. Posterior cruciate ligament from the cranial floor of the femur to the distal floor of the tibia. Between the roof of the femur and the floor of the tibia are two C-shaped pieces of cartilage called menisci, which cushion the surfaces of those two bones. Right? One more time. Lateral meniscus, medial meniscus. They cushion both the femur and the tibia. Is anybody throwing frisbees or balls to this dog to catch? That's the first question I ask in a client presenting a young large breed dog that is limping from one of the rear legs. Most of the time, the answer is yes. So why is the ACL the most prone to injuries? Dogs carry about 60% of their body weight with the front legs and 40% on their back legs. When jumping into the air, the dog generates the lift from the back legs. When landing, dog's front legs hit the ground first, followed by the back legs. That's what's going to happen if you throw the frisbee or ball 20 to 50 yards away from the dog for the dog to run and retrieve it. The running distance enables the dog to accelerate, leap for the ball, then prepare to run by shifting most of its body weight to the front legs. If you throw the frisbee straight into the air, the dog will leap into the air, catch the ball, but you have no time to prepare for running, and you likely run on the back legs. Like an aircraft about to run, a dog must extend and carry all its body weight on its two back legs. After bumping its weight on the ground, the dog must now transfer 60% of the body weight back to the front legs by flexing the knees and extending the hip and the hop joint. Remember the function of the ACL? It prevents overflexion and possible injury to the knee joint. So, the anterior cruciate ligament is the first ligament that feels the stress and strain of hyperflexed knee as it braces to transfer back 60% of its body weight to the front legs. If you are constantly throwing and encouraging your dog to jump up high at the river, frisbee, or go from close distances, be assured it's just a matter of time before your dog tears one or both of its ACLs. Alright? So, each time the dog has to put over 100% of his body weight on the back legs, bump it on the ground, and then lift, the dog lifts itself to try and transfer the 60% of his body weight back to the front legs. The stress of the knees, the stress and strain of the knees is what ruptures the anterior cruciate ligament. That's what tears the ligament, right? The anterior cruciate ligament is the first ligament that feels the stress and the strain of having to lift the 60% of his dog weight and put it back on the front legs. The severity of the anterior cruciate ligament tear determines the level of pain and limping. A dog with a partial tear of the anterior ACL will be presented with mild limping with no signs of pain. A dog with a completely torn ACL will exhibit severe pain, limping, and reluctance to use the affected leg. How do you diagnose anterior cruciate ligament tear? History of the dog retrieving balls or frisbees and clinical signs will point you into the right direction. A positive cranial draw test should increase your confidence that you are dealing with an ACL tear. But what is a cranial draw test? This is just a manual manipulation of the stiffener joint to test its stability and instability. The test involves stabilizing either the femur or the tibia with one hand, and then drawing the other, holding the other femur or tibia, whichever is on the left or right, by drawing them together and feeling the laxity in the stiffener joint. Okay. The test involves stabilizing either the lower half of the femur and the upper half of the tibia with one hand. You then straighten the stiffener joint. You then, using the other hand, you then draw the opposing edge of the stiffener joint against each other. The opposing edge of the stiffener joint against each other in a forward and backward motion to feel the laxity or the firmness or looseness of the joint. You repeat the same manipulation on the other stiffener joint and then compare both, determining if there is a torn ligament. This test is best performed while the dog is sedated to allow total relaxation of the muscles. If there is a complete tear of the ACL, you might hear a popping sound as the edge of the femur and tibia move away from each other. The test is only 50 to 75% conclusive. The most conclusive test is arthroscopy, which you offer a definitive diagnosis. But what is arthroscopy? Arthroscopy is a procedure where a narrow tube attached to a fiber optic video camera is inserted into a joint through a tiny incision. The veterinarian will then interpret the video image to diagnose the extent of the injury, if there is any. How do you prevent ACL tear? Avoid throwing frisbees straight into the air for your dog to catch. Avoid throwing the frisbee up in the air for the dog to catch, for the reason I have already discussed about, right? The dog jumps straight into the air to catch the frisbee, but it won't have time to right itself at the rod with the front legs. So it will ride on the back legs and then put 100% of his body weight on the back legs. That's too much for the two legs, right? The back legs are only supposed to carry 40%. Now you are forcing the dog to carry 100% of his body weight. That's too stressful. When the front back legs hit the floor, the dog has now to lift the 100% of his body weight through the knees, which strains the anterior cruciate ligament. So avoid throwing frisbee straight into the air. Instead, throw the frisbee or ball at least 50 yards away. How do you treat ACL? For a partially torn ACL, confining the dog indoors for a minimum of 4 weeks will help the ligament to heal. For a completely torn ACL, surgery to stabilize the ligament and aid the healing process is the ideal treatment. Your veterinarian, as usual, will determine the right treatment for your dog. That's the end of the video. If you liked what you have heard, you have learned why it is not necessary to throw the frisbee straight into the air. It's time to subscribe, share this video, comment, or ask a question below. Thank you for watching. And I'll see you in the next video.